I'll move to the next. We talk about what is known as a robotic assisted laparoscopy. Robotic assisted laparoscopy. So laparoscopy, if I'm going to describe laparoscopy, laparoscopy just simply means I want to observe inside the stomach of somebody, or I've observed, so I want to what? Do a surgery inside the stomach. Do you understand? So robotic assisted just simply means the surgeon is not there like to use their hand. He's just in the side operating through a robot. Do you understand? So these robots are so sophisticated like this. So the surgeon is actually at one operation room. He's looking through, the robotic stuff, and he's using the robot to operate the patient. Okay, of course, there's a new stuff coming up. It's a cutting-edge surgical technique, so it enhances what? Traditional laparoscopy using robotic technology. Do you understand? So you're not there, like you see this one is what? Traditional laparoscopy. The surgeon is there, their hands on work. But this one, you could even operate another patient from another country. Yes. All right. You can be, let me say I'm in Nigeria now, I can operate somebody in USA using the robotic surgery. You understand? So I think there are a lot of advantages. Okay, once it is properly done, it's definitely better than the traditional laparoscopy. So it allows surgeons to perform what complex procedures with greater precision, flexibility, and control. So how does it work? The surgeon sits as a console and controls what the robotic arms. Okay, the surgeon is somewhere controlling the surgery. Okay, a high definition of 3D camera provides the magnified views of the surgical site. So the surgeon, wherever he is, he's able to see everything happening. He's in control of everything. So the robotic system translates the surgeon hand movements. Okay, so you see all these things. This is our hand. All right, this is a human being trying to replicate the hand that God just made. So if you want to do what God is doing, you have to be prepared. So that's just what happened. Advantages: there's enhanced precision, there's superior visualization, is minimal invasive, ergonomics for surgeons, access to difficult areas. Let me say there's a place where they are fighting, heavily fighting, and I can't go there. All right, and they want to operate on a patient. I can be in my country, operate on that patient. Okay, so these are the descriptions of all the advantages that were listed for robotic assisted laparoscopy. Common applications, common surgeries that this can be applied: gynecological surgeries, urologic surgeries for urinary system issues, general surgeries, colorectal surgeries, thoracic surgeries. Limitations: is highly expensive. All right, it's not suitable for emergencies. Most of the times you need to be there to access everything. It's potential for mechanical failure. Right? How about you are doing the surgery and the whole robotic system fails? Okay, longer operating times. Okay, than something that you'd have just been there and tidy up in a few minutes. So that was it.